Hi all, welcome to NCLEX Mentor. Today, let's deal with one of the topic in gastrointestinal system, that is gastritis. So, what is gastritis? Itis in the sense which means that inflammation. So, gastritis in the sense inflammation of the gastric mucosa or the stomach. So, this is the description, and it is of two types: acute and chronic. Acute is a sudden onset, and chronic is a gradual process. So let's see in detail of acute. Acute means ingestion of food contaminated with a disease causing microorganisms. Then irritating food can cause also a cause for this. Highly seasoned food or flavored food can cause this acute gastritis. In other cases, overuse of aspirin and other NSAIDs. Excessive alcohol intake, bile reflux, and radiation therapy are the causes which comes under the acute. And what about the chronic? Benign or malignant ulcers, H. pylori, Helicobacter pylori bacteria, autoimmune diseases, dietary factors. We already discussed that the highly seasoned food. So this comes under dietary factors. Medications such as NSAIDs. So while we are using a chronic way, continuous way, this can cause to the chronic gastritis. Alcohol, smoking, and reflux. While moving to the assessment, let's see the acute first, which includes abdominal discomfort. This is the condition which is associated with the gastric mucosa or the stomach. So, abdominal discomfort definitely will be there. Then, anorexia, nausea, vomiting, headache, hiccups, reflux. So, these all are the things comes under acute. Moving to the chronic, anorexia, nausea, vomiting, then belching, heartburn after the eating, sore thirst will be there, and vitamin chances for the vitamin B12 deficiency. So what we can do for this acute and chronic? Whether it is acute or chronic, first thing we have to stop eating with the irritating foods. So food and fluids may be withheld until the symptoms subside. Afterward, and prescribed ice chips can be given, followed by clear fluid liquid and then solid food. So first we have to stop the irritating foods, then we have to take the prescribed medication, followed by a clear liquid and then a solid food. Monitor for the hemorrhagic gastritis such as hematemesis, tachycardia, and hypotension. If these signs will be occur, means we have to notify the healthcare provider. Then instruct to avoid the irritating foods, fluids, and other substances such as spicy and highly seasoned foods, caffeine, alcohol, and nicotine. These all are the causative reasons, no? So we have to instruct to avoid these irritating foods. Then instruct the client to use antibiotics to treat the H. pylori and antacids. For vitamin B12 deficiency, we can go for the vitamin B12 injection. So this is all about gastritis. Thank you.